Welcome back. In the other videos, we've talked a lot about disaster preparedness, haven't we?
Yes, and I'm a lot better prepared now. I made my disaster kit and learned a lot of new skills.
That's great, Sarah. I'm really glad to hear that.
What are we going to talk about next?
Have you been watching the news lately?
Yes, of course.
Lately, the news has been full of stories on illnesses that could affect a lot of people.
You mean like the bird flu?
That's right. In this video, we are going to talk about a public health emergency and the actions you can take to help protect yourself.
Is it different from the other disasters we talked about?
It is different, but we can handle it the same way.
You mean think, plan, do.
Exactly. We think about the problem and how it can affect us. We make a plan, and then we do what we have to do to get ready. Let's begin by talking about what the bird flu is and what it isn't. Bird flu is actually a sickness that affects only birds. While some people have become very sick from the bird flu, they are people who spend a lot of time around birds. The chance of it actually infecting you is very small at this time.
So why do I hear so much about it? Why is it so scary?
People are worried that it might move from birds to people and make us sick. However, that's not yet the case.
So I don't need to worry about it?
Like all possible disasters, you should listen to the news in case things change, but you shouldn't be frightened. Just like earthquakes, fires, and winter storms, disease has been common throughout history, and we should prepare for it just as we prepare for those other disasters.
So what can I do to prevent catching a disease?
Do you remember when we talked about earthquakes? We looked at what happens during one and came up with ways to help protect ourselves.
You mean like securing pictures in bookcases?
That's right. Now let's think about diseases in the same way. What causes it?
Germs cause diseases.
That's right. We can help stop the spread of bacteria and viruses through good personal hygiene.
What do you mean by personal hygiene? Washing my hands?
Exactly. Something as ordinary as washing your hands can help prevent disease. You should always wash your hands before you prepare food.
And after you use the restroom?
That's right. Use soap and warm water and rub your hands together for at least 15 seconds.
What else spreads germs?
Sneezing. If you think you are going to sneeze, cover your nose and mouth with a handkerchief. Sneeze into your elbow if you don't have a handkerchief. Don't touch doorknobs, handles, or a person until after you've washed your hands. Do you know what else spreads diseases?
I'm not sure.
Believe it or not, a lot of people go to work sick. If you get sick with a cold or flu, what should you do?
Stay at home until you are better.
That's right. It's selfish to be in contact with others if you know you are sick. Everyone will be grateful if you stay at home and get better.
So the best way to fight the spreading of germs is to wash my hands and try to stay healthy. That's so easy to do.
I know, but it's very important and it will make a big difference. Now you know some basic skills to help against spreading diseases. Let's talk about what could happen if a public health emergency took place.
What is a public health emergency?
A public health emergency is when a disease threatens the health of all of us.
So how will it affect me?
Remember how we deal with disasters?
Think, plan, do.
That's right. Think. Public health officials will announce any potential threats caused by a disease. They will tell you what it is, what they know about it, and the ways that you can reduce your risk of catching it.
You mean like washing my hands?
You should be doing that all the time. No, a public health emergency may cause a lot of changes for you. Public health officials might tell you to stay away from large groups of people, such as at the mall or movie theater. They may even close places like these.
But I work at the mall.
You may not be able to travel to work. Public transport might be stopped and roads may also be closed.
How'll I get to church?
Even the church may be closed. We have to think about things like this so that we can develop our own plan.
What about food? What about my medications? Will my emergency contact friends be able to help me?
Remember when we talked about preparedness in the earlier videos? We've already answered those questions.
What do you mean?
Well, we talked about the need for keeping 3 to 7 days worth of food in the house, right? And remember how we said that you should stock up on supplies if it looked like a disaster might occur?
Yes.
Do you also remember that we said that your emergency contacts need to be part of your planning?
Yes. So I should talk to them about this and keep in touch with them during a public health emergency.
Exactly.
So I do have a plan.
That's right. Remember, your kit and plan can be adjusted to help you in any disaster.
So what else may I be told to do during a public health emergency?
Public health officials may ask you to visit a site to receive special medications.
What do you mean, a site?
An area that will probably be a large space full of people waiting for medication just like you. When it's your turn, someone will speak with you.
What should I say to them?
Be sure to tell them about any medications you are taking and any special needs you have. They're trying to help you, so don't be shy.
Okay.
They might give you a shot or even some pills. If you are given any medication, make sure that you get written instructions on when and how to take them and follow them carefully.
What if I become sick?
Call your doctor at once or someone from your emergency contact list. You may be told to stay home or even be moved to a hospital. You may also be told that you are quarantined. This means that you will only be in contact with the person caring for you.
Why?
Because if you are very sick and you see your family and friends, you may get them sick too.
That sounds serious.
It is, Sarah, but it may be necessary to keep you from making others sick. There will still be people to take care of you. It's just that they may be medical staff or have to wear a mask.
This really seems scary.
Public health emergencies, like all emergencies, can be frightening. But you can help limit the effects by good hygiene, good planning, and good sense. Remember, think. Get the facts and think about what is happening. Plan. Talk to your emergency contacts. Check your disaster kit. Review your personal plan. And
Do. Keep in touch with your emergency contacts, follow the health department's instructions, and always follow your plan.
does it still seem so scary?
No, not as long as I think, plan, do.
That's right.